This video is going over symptoms related to observing face. One of the things that we've touched on already in a previous video was about the changes in color that you might observe in the face. What we're talking about is changes in color related to other symptoms in most cases. We did touch on in the eye and vision video that discoloration under the eye is fairly common in pans and pandas, not really that useful in selecting remedy, but it can be useful to just observe as like a trend for overall how people are doing. Same thing with getting really pale. A lot of these kids tend to be more pale because they're less healthy. And so watching that is not always as useful as far as a symptom for selecting a remedy, but it can be useful just like the blue circles for helping us understand how they're doing. But what we're looking at is like when they get angry, do they get a bright red face? Do they have an ear infection and they have one red cheek and one white cheek? Or do they have that even if they're angry? Do they, when they get any symptom, any other physical symptom or mental or behavioral symptom, do they lose color at that time, not just always pale? Do they have white around their lips? Do they have splotches on their face? And things like that. That type of coloring does make a really big difference. Dr. Petersons, why don't you talk a little bit more about some of the things that we could see in just like just by observing the face. It's not necessarily directly associated with a symptom, but that could be useful.
Yeah. So looking at the face as a whole, you could have a furrowed brow or a super wrinkled brow in a kiddo is definitely unique. Swelling above the lids. I have some Cali carbonicum lids, so they're like swelling above the lids. Any kind of eruptions on the face. If the face tends to get puffy or swollen at certain times, that could be useful. And then, dryness in the lips or an oily complexion or a yellowing of the skin. All of those can be something that you could observe that maybe doesn't come on with symptoms, but is there part of their general symptom picture.
And we had talked also briefly before, but like related to nose and smell. But if you notice like flaring of nostrils, that can be a really useful symptom as well, just in case you didn't catch that video. I think that really rounds it out. Like there's not a ton of symptoms associated with the face. It's more about like the observations of the coloring and the general observations that, but yeah, like you said, you can even have like the furrowing of the brows. I can't do it because I have Botox for migraines, but the furrowing of the brows that you can get with some symptoms as well, or the lines, as you said. So those can come along with symptoms or just be present either way. Just want to make sure that was really clear too.
We talked a little bit more about the face and like facial tics, but winking, blinking, mouth grimacing, crunching, clenching, those types of things.
Yeah, so if that's what you're looking for in this face video, go check the neurological nervous system video, because that's where you'll find that information. All right, we'll see you in the next video to talk more about the musculoskeletal system.